afternoon and welcome to Spotlight. I'm Barry London, joined this afternoon by Dr. Francisco Albert, hospitalist at Lexington Medical Center. Thank you for joining us, Doctor.
Thank you.
Now, tell us, what happens during a stroke?
A stroke is essentially a traumatic event to the brain. And what it entails is a lack of blood flow to the brain or a bleed within the brain.
Okay. Now, tell us about the risk factors of stroke and why blood pressure plays such a crucial role in that.
Sure. Several risk factors for stroke that come to mind: hypertension, diabetes, high cholesterol or hyperlipidemia, cigarette smoking are probably the main risk factors. And hypertension is probably the most relevant in terms of the risk of death. We know that about 50% of deaths occur with stroke because of hypertension, and they're usually bleeding strokes.
Okay. Now, when talking about stroke symptoms, we often hear the acronym FAST, or F-A-S-T. Can you define those for us?
Sure. FAST is the acronym that came out by the American Heart Association, and what that is designed to do is alert the population of identifying strokes either in a friend or family member or in oneself. And what that acronym is the F in FAST stands for face. And what you have to ask the person to do when you think they might be having a stroke is actually ask them to forcibly smile. And if you see that there's a droop of one side, that could be indicative of a stroke. The A in FAST is arm. If you actually have them put their arms out, close their eyes, and if you see a type of movement that's unusual, like I just showed, that could be indicative of a stroke as well. Asking them to say a certain sentence, no ifs, ands, or buts, some kind of sentence. And if you see that they slur in their speech, that could be a stroke. And time is the T in FAST. And what that indicates to the population, the importance of getting to the emergency department soon after symptoms develop so that interventions can be made.
Okay. Now, what are the latest treatments for a stroke, and why is timely treatment so crucially important?
Sure. Blood thinners like aspirin and other similar medicines are the mainstay long-term. But when someone comes in with a stroke and they're able to be treated within a short period of time, within 4.5 hours of onset of symptoms, they can use a fibrinolytic or a clot buster. And what those are medicines administered through an IV, and they act to bust clots and restore blood flow to the brain.
Now, the Southeast has a particularly high rate of stroke compared to the rest of the country. Can you tell us why that is?
Sure. From 2006 to 2010, the Centers for Disease Control came out with this prevalence of stroke in the United States. And across the board, there's about a 2.5% prevalence of stroke in the United States. The Southeast has a prevalence as high as 4%.
Really? Okay. So that's due to dietary factors?
It's due to dietary factors. It's due to hypertension is by far the greatest risk factor, in particular in our part of the country.
Now, you can join Dr. Albert and Lexington Medical Center on Monday, May 19th for a free physician's lecture called Stroke, Every Second Matters. The lecture is at 6 p.m. inside the Lexington Medical Park 1 auditorium on the hospital campus. Attendees can ask questions and light refreshments will also be served. For more information, you can visit lexmed.com. Dr. Albert, thank you so much for joining us.
Thank you for having me.
And thank you for joining us for Spotlight. The preceding was a paid program sponsored by Lexington Medical Center.